The deltoid ligament, or medial ankle ligament complex, is composed of the posterior and anterior tibio-talar ligaments, which form the deep layer of the deltoid, the tibio-calcaneal, tibio-spring, and tibio-navicular ligaments, and it is possible to differentiate all of these on ultrasound. To identify the deltoid, we find tibialis posterior and scan inferiorly. Once we fall off the tibia, we need to dorsiflex the foot, and here we can identify the posterior tibio-talar component of the deltoid, the most common component to become pathologic. With the foot still in dorsiflexion, we can plant one end of the probe on the tibia and rotate the bottom end of the probe to identify the tibio-calcaneal component. Here is the sustentaculum tali of the calcaneus, the tibio-spring ligament, whose fibers blend in with the spring ligament, an important area of assessment, and then the anterior tibio-talar component. The tibio-navicular component is variable and not an area that I routinely assess unless I'm looking at a specific deltoid ligament injury or for anterior ankle impingement. In real time, this is what this would look like. In an ankle inversion injury, arguably the most common ankle injury that we encounter, the tibia and the talus will collide, which can often result in a post-traumatic synovitis. The posterior tibio-talar ligament can appear hypoechoic, but with the foot relaxed, we can see excessive vascularity. In an eversion injury, often the syndesmosis will be injured, but this can also affect the deltoid, and so differentiating these ligaments can be helpful. In this example, the posterior tibio-talar and spring ligaments remain intact, but we have a partial tear of the tibio-calcaneal component and a high-grade near-complete tear of the tibio-spring, anterior tibio-talar, and tibio-navicular ligaments. There is also evidence of an injury to the flexor retinaculum, which is markedly thickened and hypoechoic, and is an important consideration in a deltoid ligament injury. Thanks for watching, guys. Like and subscribe for more.